Welcome to Nursing Journey. In this explainer, we're going to break down the absolute essentials of clinical nutrition. These are the core concepts you've got to know, not just for your exams, but for your day-to-day practice. First off, let's talk about how crucial proper nutrition is for patient healing. It supports literally everything, from immune function all the way to wound repair. And of course, it's what provides the actual energy that fuels every single metabolic function in the body, which makes it a cornerstone of clinical recovery. You can see why mastering these concepts is so important for your nursing practice. All right, so here's how we're going to tackle this. We've structured everything to build your knowledge step by step. We'll start with nutrition's role in the clinic, then get into macronutrients and patient assessment. After that, we'll dive into therapeutic diets and wrap it all up with key takeaways and a real-world clinical application. Okay, let's get started. So first things first. Why is nutrition such a critical pillar in patient care? Well, it's so much more than just what's on the meal tray. It's about giving the body the exact resources it needs to fight off infection, repair damaged tissue, and keep organs functioning properly. Okay, let's get into the fundamentals. We're talking about the 3 core macronutrients, and you have to know their energy values. Seriously, it's non-negotiable for any clinical calculation you'll do. So for both carbohydrates and proteins, the number to remember is 4. 4 kilocalories per gram. This is a foundational number. You're going to use it all the time. Now, fats are a different story. They're the most energy-dense of the bunch, packing 9 kilocalories per gram. That's more than double the others, which is a huge deal. And it's not just about energy, right? Each macro has a really specific job. Carbs are the body's go-to fuel source. Proteins are the building blocks that repair tissue. And fats, they are absolutely essential for absorbing key fat-soluble vitamins. So let's lock in those core numbers, 4, 4, and 9. Super simple, but totally crucial for all your calculations. Okay, now that we've got the building blocks down, let's see how we actually measure their impact on a patient. All right, let's shift gears to assessment. When it comes to evaluating a patient's protein status, there are 2 key lab values you absolutely have to know: albumin and prealbumin. Here's a great way to think about it. Albumin is like a marathon runner. It has a long 20-day half-life, so it gives you the big picture of protein status over several weeks. A low albumin level might point to chronic malnutrition. Prealbumin, on the other hand, is the sprinter. It's got a super short 2-day half-life, making it the most sensitive indicator for acute changes. It tells you what's been going on nutritionally just in the last couple of days. So here's the bottom line. You use albumin for the long-term, chronic view, and you turn to prealbumin for that real-time snapshot of acute nutritional changes. Okay, fantastic. Now let's start applying this knowledge and talk about tailoring nutrition to specific medical conditions. We'll begin with something common: texture modification. You'll see this all the time. Dietary progression usually follows a kind of texture ladder. For example, post-surgery, we might start a patient on clear liquids to give their bowel maximum rest. Then, as they improve and can tolerate more, we advance them step by step, all the way back to a regular diet. Now, let's talk about a really common and critical intervention: the sodium-restricted diet. This is often prescribed for patients dealing with hypertension, heart failure, or kidney disease. The whole goal is to help manage fluid retention and bring down their blood pressure. And the key here is pretty simple. You want to avoid highly processed, canned, and cured foods. We're talking about things like smoked salami, most canned soups, and even some instant oatmeals. Instead, the focus is on fresh, whole foods like summer squash, apples, or simple steamed veggies. Oh, and here's a super high-yield fact you need to know, especially if you have vegan patients. Vitamin B12 is found only in animal products. This is huge because a deficiency can cause irreversible neurological damage. So for anyone on a strict plant-based diet, supplementation is absolutely essential. So quick recap on that section. Therapeutic diets are always tailored to the patient, whether it's texture or specific nutrients like sodium. And don't forget, specific vitamin sources like B12 can be a critical consideration. All right, we've covered a lot. Let's quickly summarize the most important high-yield points that you really need to lock in for your exams and your practice. Okay, remember these, the magic numbers for caloric values: 4 for carbs, 4 for protein, 9 for fat. For labs, albumin is your long-term history, prealbumin is your current snapshot. For a sodium-restricted diet, the mantra is fresh over processed. And for vitamin B12, it's gotta be animal sources. Okay, now for the fun part. Let's see how all of this comes together in a real-world nursing scenario. So let's put this into practice. Imagine you're doing discharge teaching for a client with hypertension who's going home on a new low-sodium diet. Your main job is to make sure they can identify which foods are the right choice for their new plan. In this situation, the correct application of your knowledge is guiding them toward fresh choices, like summer squash. You'd also explain why processed items like that canned soup or even some prepared meats are off limits because of their high sodium content. This is a perfect example of how your teaching can directly impact a patient's health and recovery. If you like this video, don't forget to like, share, and subscribe or follow.